be doing some cervical traction training. So this is the cervical traction unit. We use this for neck patients. What it does is it just lengthens the cervical spine. Sometimes it can be causing some pain for people, and so we want it to ease that pain and that pressure. So the kind of components we have are these neck bumpers. These are the things that go around their neck so that it holds, so that it can provide a little traction. We have the forehead strap, and then we have these two components back here. You can do different levels of how high the unit sits whenever it sits on the base. So we can remove these risers. We can either have a low setting where we take these both off, or you can have it at a high setting where you put both of these on. So how we set it up is we always put this down on the table just to provide protection to the table. Then we put the traction unit on top of it. And then we have this black piece of foam that goes over these metal bars for the comfort of the patient. From there, I would have my patient go ahead and lie down with their neck in between these two bumpers. You want it to sit kind of at the base of their skull, back here behind their ears, whenever they do lie down. From there, I'm gonna put their feet up on the bolster so that their low back is comfortable. And then when they're in this position, I want to kind of form the neck things. They kind of rotate out. You want to form them to the kind of shape of the patient's neck. And then I'm going to take a tissue and put it over their forehead so that we're not spreading any germs on the forehead strap here. We're going to put that over, and then we're going to tighten it on these Velcro strips. Try to make sure you don't get their hair in it. Doesn't feel very good. And you don't want to do this one overly tight because it is going to shift a little bit during the treatment, but you do want it to be snug enough to where it stays in place. The second step is after you've molded these kind of to the shape of their neck, you want to make sure there's a little bit of pressure pulling up, and then you're going to tighten these knobs here on the side. You want it to be tight enough to where it's pretty snug to the patient, but not overly tight where it's causing them discomfort or pain. So Caden, I'm gonna have you tell me whenever that feels pretty good.
Okay, that feels good.
Feels good right there?
Yeah.
Okay. And then we're gonna go on to the pump. It has a gauge right here which tells you how many pounds of traction you're doing. It also has 3 settings so that we can do. The middle setting is where you can actually pump up the traction to make sure or get it to how high you want it. If you turn it to the left, that's how you're gonna lock it in place, kind of at the height of the traction, and then to the right is how you're gonna release it. So the first thing we wanna do is make sure it's on the middle, and then we're going to start in this shortened position, kind of bring it up where it pulls some air in, and then push it up. If it's a patient's first time, you want to make sure that they're comfortable and understand kind of what's going on, kind of make sure they're doing okay as you're going up, and always make sure you tell them that we can turn it back down if it feels too high. You just want it to be the first round, you want it to be just kind of a slight stretch. You don't want it to feel like it's really, really pulling their head off or anything like that. So you let me know when you start to feel a good stretch on your neck, right there. Okay, and then you're gonna make sure it's in the left position where it's locked. From there, we usually leave them for about 5 minutes. Let's pretend it's been 5 minutes. And then we're gonna go over to that right position to release it. Before I do that, I always wanna kind of hold onto the bottom of the traction unit as I'm releasing it so that it doesn't just slam their head down. So sometimes I'll turn it right with my left and kind of provide a little bit of resistance with my other hand as it comes down so that it goes down nice and slow. The second time around, usually you can let them go up a little bit higher. So we'll do a second round. And if they have discomfort, like let's pretend Caden said that he's feeling some pressure or some pain right now, we're just gonna slowly kind of back off of that, and then if this is comfortable for him, we'll just kind of lock it in this position and leave it here. Always check in with the patient, just make sure that they're feeling comfortable, and that is traction.